Symptoms commonly associated with the cold are sore throat, cough, difficulty to swallow sputum, and etc. What causes sore throat? Have you ever experienced a cold with sore throat? The reason behind the pain and swelling is from tonsillitis. Some people want to receive tonsillectomy operation, but removing a tonsil isn't the best choice. This part of the Oriental Medical Digest will discuss how tonsillitis is treated. A tonsil is the assembly of lymphatic tissues. Closer examination reveals various types of tonsils. Faucial tonsil look like an apricot seeds. Pharyngeal tonsil is located behind the uvula, and lingual tonsil is behind the tongue. These tonsils are linked to surround the throat. Tonsil is a primary defense mechanism against the invading germs.
Oriental medicine explains the cause behind tonsillitis as the invasion of heat toxins into the lungs. In other words, when the toxins that generate heat and inflammation enter the body, the tonsils, being the gateway, are inflamed from guarding our body against the foreign substances.
Oriental medicine classifies the origin of tonsillitis into 3 categories depending on the types of toxic heat. First is from the heat invasion or common cold. Cold often causes increase in the body heat, and tonsillitis results from remnant heats in the lungs. High fever persists for 3 to 4 days with the symptoms of sore throat, headache, alternating with body chills. Tongue is pinkish in color and the tongue coating appears white or yellowish. Even slightest touch on the pulse feels rapid beating. Second case manifests in the people with weak constitution. People with congenitally weak in energy, engaged in excess sexual activities, and overworking are prone to tonsillitis. Chest feels stuffy and likely to have foul breath. Feels lethargic and dislikes water despite thirst. Burning sensation on the face. Pulse is thin and rapid. Third case is popular among the children under heavy stress. This is due to liver energy stagnation. Symptoms are similar to the second case but feels very hard on palpation. Pulse is deep and wiry. Severe case shows difficulty in swallowing a sputum and dyspnea. Acupuncture treatment for tonsillitis is mainly to reduce the fever on the neck. Invisible energy known as qi or life force flows within the meridian. When the flow of qi is obstructed, an acupuncture needle is inserted to invigorate the circulation.
This treatment is to relieve the swelling of the throat. This point is pungbu, directly below the external occipital protuberance, approximately 2 centimeters above the posterior hairline, a popular point to treat throat diseases. The second point is sangsong, 1.5 centimeters directly above the midpoint of the anterior hairline, treats nose and throat pain.
비염이나 코막힘, 인후가 부어서 아픈데 주치하는 혈입니다.
The point between the first and second metacarpal bones is hapgok, an important point to treat diseases manifesting on the face and neck. The last point is joksamli, located 5 centimeters below the lower border of the patella. It is an excellent point for the treatment of gastric pain and supplements other points for more effective results.
Tonsillitis patients with severe swelling often receive a treatment to withdraw the blood. Reason behind the swelling is compilation of the toxic blood. This needle has 3 prongs for an easier extraction of the blood. This point is called 소상, located on the thumb near the corner of a nail. Extracting blood here will relieve the chest stuffiness. Another point is called 상양, good for the sore throat and swelling. Both points should be used together to increase the synergy effects.
두 혀를 같이 피를 뽑으면은 효과가 배가가 됩니다.
Ear acupuncture is also good for tonsillitis. Since numerous nerves are accumulated on the ear, small and thin needles are used. Needles to fix on the ear is called as dermal needles.
이 자리고요. 두 번째
Ear has points that represent each organs. Find the tonsil point on the ear and insert a needle. The reason behind fixing a needle on the ear is to give continuous stimulation for more effective treatment. If the tonsillitis is brought on by the cold or weak constitution, then various treatments in Oriental medicine can provide effective results. But if a child is suffering from a chronic tonsillitis, long-term use of herbal medicine is recommended over the acupuncture. We'll take a look at the herbs used in treating tonsillitis. For children with chronic tonsillitis due to weak constitution, tonifying herbs are given to strengthen the body. 숙지황, 백봉령, 산약, and 산수유 are prescribed 4 grams each. Acute tonsillitis is treated by reducing the fever and detoxify the toxic heat. Again, 길경, 금은화, 황금, and 연교 are prescribed 4 grams each. Fourth treatment medium is moxibustion. Moxibustion is usually done with mugwort to warm the affected area, which in turn attracts leukocytes to promote blood circulation.
Moxibustion is good for chronic tonsillitis. 2 types are available depending on the condition. In the case of the swollen throat, a small moxa cone is applied 2 to 3 times on the thumb near the corner of the nail. Make sure the left thumb is used for male patients and the right thumb is used for female patients. This is more effective. For chronic inflammation, a moxa is applied on the point about 5 centimeters below the earlobe, several times. Again, remove the moxa before the skin burns. Chronic illness of the nose and throat must be treated. Keeping the mouth cavity clean is also important. If the human body sustains a good level of immunity, tonsillitis can be easily prevented.
Frequent toothbrushing is one of the ways to prevent tonsillitis. You probably are aware that all the germs and bacteria causing tonsillitis are entered through the mouth. Engaging in a daily exercise is important for a healthy life, and brushing your teeth 3 times a day is equally important. Thank you for joining us today. We'll see you again next time.